Okay. Now, antiviral. So, one, if you have a cold, the antibiotic won't help you. If you get an ear infection from having the cold, then you take an antibiotic for the ear infection, but it's not going to help your cold. Colds are caused by a virus. There's nothing to treat a cold at this point. But we have many viruses that we can treat. So there's different groups. Again, you don't really necessarily need to know some of these classifications, but later on for the continuing students, you will need to know these a little bit better. So the first group are the neuraminidase inhibitors. Those are used for the flu. We have nucleoside analogs. Those are used for herpes, herpes simplex, genital herpes, cold sores, and herpes zoster, shingles, and antiviral monoclonal antibodies for RSV, respiratory syncytial virus, which affects small babies and the elderly. Then we have a group of antivirals that are known as antiretrovirals. These are used to treat HIV and AIDS. Some may also treat certain strains of hepatitis. HIV and AIDS are a specific type of virus known as a retrovirus. It does its genetic coding backwards. It transcribes the information in reverse. So that's why they're called retrovirals. And there's basically 7 groups, but one of the medications that you have is grouping 3 of them together. So you have 5 classes to identify. So the first antiviral is a topical. It's sold over the counter. It's called dicosanol, known as Abreva. It's used for cold sores, herpes simplex 1. It's a 10% cream. That little package, that vial, is the little pump is only about this tall. It's smaller than a lip gloss. The tube is very, very small, and it costs about $18. But it will help reduce the cold sore by several days. The earlier the patient uses it, the better it is. It kind of freezes the cells around it so it doesn't spread. So the thing about herpes, it gets in your body, and it lives in your nerves, and it's just waiting for that perfect opportunity to come out. And when you're starting to get sick and your immune system's busy trying to fight that off, it's the perfect time for that virus to rear its ugly head, which is why it's called a cold sore. You get it when you're getting a cold. You're getting sick type of thing. Most people have been exposed to herpes simplex 1 by the time they're 6 years old. Why do you think that is? Uh-huh. Uh-huh. Maybe, maybe not. A relative kissing? Because even before you feel the fever, they call them fever blisters too. Even before you feel it, it's like a tingly thing. It could always already be contagious. So by the time we're 6, most of us have been exposed. Antivirals. Neuraminidase inhibitors are used for the flu. They have a drug stem of Mivir. Oseltamivir is Tamiflu. Comes in capsules or an oral suspension. And Zaminavir is Relenza. I have it misspelled on your drug list. This is a note. It's Z-N-A-N-A, not I-N-I. That's called Relenza. It's actually an oral inhalation, and it's 5 milligrams per inhalation. And they come preloaded with 4 doses. But usually you need more than 4 doses to treat. Now, patients who have the flu, they should begin treatment within 48 hours of the onset of symptoms for the best results. If you've been exposed to someone with the flu and you've not had your flu shot, you can take these drugs prophylactically. You only need to take them for a short time, where the patient who has the active will take it for a short period of time. The person exposed will take it longer, approximately 6 weeks. Your antiviral monoclonal antibody, well, this is easy to identify as a monoclonal antibody because it ends in mab. Telivizumab is Synagis, and it's only given by injection, and it treats RSV. Now, your drugs that treat herpes simplex and herpes zoster are your clovir groups. Acyclovir is Zovirax. Comes oral, tablet, capsule, suspension, also available by injection. Valcyclovir is Valtrex, and it comes tablets and oral suspension. Drugs that we use to treat hepatitis, specifically hepatitis C, which can be chronic. We've got entecavir, which is Baraclude, comes tablet and oral suspension. This drug needs to be taken on an empty stomach. A combination drug of ledipasvir, and sofosbuvir is Harvoni. You may see this one on TV commercials recently. Comes in a tablet form. Simiprivir is Olysio, and it comes as a tablet. And sofosbuvir comes by itself as Sovaldi. I think of that as the solo version. This is harmonious. They work together. So it comes part of two different drugs. So those drugs are used to treat hepatitis C. Then we have a combination drug of Bitsivir, Paritaprevir, Ritonavir, and Decapivir, which is Vicura, which comes in a tablet form. To me, I'm probably more afraid of hepatitis B and C than I am of HIV or AIDS. And now, being of the age that I am, they're like, you know, a lot of people my age have been exposed to hepatitis C and don't even know it. It's like, ooh. Liver? Yeah. So there's lots of different ways to be exposed to hepatitis C and B blood products through sexual contact. You know, there's a lot of different shared needles for people, you know, stuff like that. All right, now we have the antiretrovirals. So these are your HIV drugs. Now, some of these can also be used to treat hepatitis C, but these are specifically in HIV. So there's an NRTI combination. It's two NRTIs, emtricitabine and tenofovir, which is Truvada. Again, maybe you've seen this one on TV. This drug is used for PrEP. So that's pre-exposure prophylaxis. PEP is post-exposure prophylaxis. We don't have any drugs on PEP. But PrEP is very common. So if somebody has a partner who's HIV positive, but they are not, to help reduce their risk of contracting HIV, they can take this medication prophylactically, pre-exposure. So Truvada is, and it comes in four different strengths. Yes. A combination of NRTIs, NTRTIs, and NRTIs. Again, next semester, continuing students will break down what all that means, but now abbreviations are sufficient. Efavirenz, emtricitabine, and tenofovir is a tripla. It's got 3 drugs in it. A triple drug, a tripla. Integrase strand inhibitor. This is one of the newer classes in the last 10 years. So we're still developing drugs to treat HIV. Raltegravir, which is known as Icentris, and it's tablets. Fusion inhibitors. It stops the HIV virus from being able to get into the cell. Enfuvirtide, fusion inhibitor. Fuvirtide, FU, fusion inhibitor. Fusione, fuse. They all kind of sound alike. This is given as an injection. And then we have the CCR5 antagonist, miraviroc, which is cell entry. It prevents entry to the cell. And that's a tablet. And then protease inhibitors. So protease inhibitors are one of the older groups. They're all oral. They have some symptoms or some side effects that are very common. We call it the protease paunch. They kind of get a little doughy while taking this medication. Atazanavir is Rayataz, comes capsules. Darunavir is Persista, comes as tablets. Got pictures of that one. And then boceprevir is Victrellis, and that comes in capsules. That's where we're stopping today, in case that wasn't enough. Look at that. Still a minute and a half to spare. I'm sorry? The plague? Yes.